It allows surgeons to heal hearts without breaking bones. Tonight, NBC11's Health Watch reporter Marianne Favreau shows us how patients are benefiting from this new procedure. Marianne?
Well, surgeons at Invasive Summit Medical Center in Oakland have successfully performed this new technique now on 60 patients. And instead of a foot-long scar to remind them of their surgery, patients have one that's only about 3 inches long.
Okay.
Margot Geiger of Oakland was battling breast cancer when doctors hit her with even more bad news. She had a tumor inside her heart.
It was about the size of a lemon.
She needed open heart surgery, which usually requires the cracking of the breastbone.
Because of the fact that my resumption of breast cancer had come back in my bones were very brittle, my ribs contained many, many fractures, and therefore cutting through the sternum, which I gather is the traditional heart surgery, was not an option.
So cardiac surgeon Dr. Junaid Khan at Invasive Summit Medical Center decided to perform a new minimally invasive open heart procedure to remove her tumor. Instead of making a foot-long incision from the neck to below the rib cage and cracking the chest bone, he made 2 very small incisions, one below the breast and one in the groin. Dr. Khan also uses this technique to repair and replace heart valves, using a tiny camera to guide him. For patients, the smaller incision means a shorter hospital stay.
The recovery has been much faster for our patients when we've done it this way compared to the old-fashioned standard way. We've had a large number of our patients leave in 2 days, 48 hours after surgery, where in the old-fashioned way, we used to have to keep them around for 7 to 10 days to recover.
Known as the port access procedure, it requires up to 2 additional hours on the operating table and poses the same risk of death and complications as traditional open heart surgery. But infections associated with cracking the breastbone are eliminated, and patients can get back on their feet more quickly.
I was out of bed the next day, walking.
Now, Dr. Khan has performed this procedure on patients ranging in age from 17 to 84. He says it's not a technique that can be used during an emergency. I'm Marianne Favreau, and that's tonight's Health Watch.
All right, thank you.
You know, I felt well enough to go to Asia to try to keep up with President Bush, and we're going to go play golf tomorrow, so I'm not in too bad a shape. I feel good about it.
You should have seen him going town to town, country to country. Energizer Bunny here killed me. But, so if this thing, whatever he's got, if it knocks you out, it hadn't got to him yet.
Since undergoing quadruple heart bypass surgery last September, Mr. Clinton has remained active, walking up to 4 miles a day near his home in Chappaqua, New York. But recently, he started feeling discomfort in his chest when walking uphill. Doctors say an X-ray revealed the rare complication that resulted in a partially collapsed lung.
This is not an emergency. This is being done to assure that he is able to continue to maintain a highly active lifestyle and that he's not at all functionally limited by his lung.
Doctors expect a routine operation and several days of recovery in the hospital.
This kind of thoracic surgery is not uncommon.
Junaid Khan is a cardiac surgeon at Invasive Summit Medical Center in Oakland. He says Summit performs hundreds of similar procedures each year and that complications such as President Clinton's usually occur in about 5 to 10% of heart patients following surgery.
Usually, typically, they'll put in a couple of cameras, maybe a camera here and a couple of instrument access areas to drain the fluid, break up the pockets, and leave a few tubes in. If everything goes according to plan, usually the patient's in the hospital 1 to 3 days after this kind of surgery.
Former President Clinton plans to slow down for the next couple of weeks, but he says he's anxious to get in and out of